Minutes.
I thank the gentleman. Last decade, when I was a state senator in Pennsylvania, I took on HMOs and plans that made decisions by accountants and MBAs and not MDs. It was important to do that because we found that doctors could not make decisions even though they were supposedly empowered to do that. Instead, there was boards that would make decisions for them. And now here we are with deja vu all over again. We're about to have 15 presidential appointments, even under the advice of both chambers of commerce, both chambers of Congress. None of them are involved with medicine making decisions with regard to who makes decisions for you in terms of what gets paid and how much you get paid to doctors and hospitals. But as it goes through, what happens if there's a decision that says it's not going to be covered? Can you call the board itself? No. Can your doctor call the board? No. Can your hospital call the board? No. Can your member of Congress call the board? No. But in fact, it will take an act of Congress passed by the House and Senate and signed by the President to override that. So who is this panel and what decisions can they make? By law, it's people who are involved with finance, economics, hospital administration, reimbursements, some physicians, health professionals, pharmacy benefit managers, employers, people involved with outcome research and medical health services and economics. What's missing from that is any requirements that it might be people who have knowledge of such things as oncology, endocrinology, pediatrics, obstetrics, geriatric medicine, family medicine, surgery, and the list goes on and on. So in other words, what's going to happen here is not only if you don't like your doctor, you may not be able to keep it, but if your doctor doesn't like what is going to be covered, there's nothing that he or she can do about that. This is not the practice of medicine. This is the practice of government overtaking medicine. While Americans were begging for us to fix a broken system, what they got was $500 billion in new taxes, $500 billion in Medicare cuts, trillions in new costs, and massive mandates. 1,978 new responsibilities of the Secretary of Health, 150 boards, panels, and commissions yet to be appointed, and we don't know what's going to happen. We need to return health care to where it really is going to be fixed. And with that, I yield back.